So let's look at another important component of women's health: post abortion care. Post abortion care is actually care given to women after an abortion. So, post abortion care is a package of medical, emotional, and social support services offered to women who have had a spontaneous or induced abortion, which could be complete, incomplete, or complicated, to preserve health, prevent complications, and reduce repeat unintended pregnancies. So, what are the core components of post abortion care? Most international guidelines like World Health Organization, International Federation of Gynecology and Obstetrics describe five essential elements of post-abortion care. So, what are these elements and what do they involve? First is emergency treatment of complications. So, prompt management of incomplete abortions, heavy bleeding, infection, uterine perforation, or injury. Second is family planning slash contraceptive services. Immediate counseling and provision of modern contraceptives such as pills, injectables, implants, intrauterine contraceptive devices, condoms to prevent repeated unintended pregnancies. Now, family planning is essential in post abortion care, hence, it creates a room to prevent further unintended pregnancy. Third is counseling and emotional support. You address feelings of guilt, anxiety, grief, discuss reproductive intentions and safe practices. After an abortion, especially induced abortion, there's usually this feeling of guilt, anxiety, and grief. As a medical health professional, you are to address such feelings in order to retain emotional stability in your patients. Fourth is linkage to other reproductive health services such as STI screening slash treatment, cervical cancer screening, HIV services, antenatal care if continuing pregnancy. Fifth is community and partner involvement, education and support to reduce stigma and promote timely care seeking. So you educate the woman and give her support to reduce stigma and promote timely care seeking. So, what are the immediate clinical care steps? First is assessment. You check for vital signs like blood pressure, heart rate, hemodynamic stability. You take obstetric history such as previous pregnancies. Second is management of incomplete abortion. You do manual vacuum aspiration or medical evacuation. Here you give misoprostol and or mifepristone depending on gestational age and setting. So manual vacuum aspiration is important here because you need to remove remnants of the incomplete abortion or improperly done abortion. So the third is treatment of complications. Here you give IV fluids, you do blood transfusion for shock, that's hemorrhagic shock. You give broad spectrum antibiotics for infection slash sepsis. Normally, after an incomplete abortion, the remnants behind are usually a good environment for harbor of microorganisms and infection. So you also do surgical repair if there is perforation. Post abortion Post abortion contraception. Most methods can be initiated immediately after treatment if there is no contraindications. Intrauterine contraceptive device can be inserted after complete evacuation if no infection. Counseling should be voluntary, informed, and non-coercive. So you need to counsel the person, but it must be voluntary. The person must be informed, and it shouldn't be by force. So, counseling and follow up. Explain warning signs such as heavy bleeding, fever, foul discharge, severe abdominal pain. You offer psychological support, you address stigma and confidentiality. So you give the lady in concern psychological support. You also address the stigma she's carrying, and you ensure that whatsoever she's discussing with you remains between the both of you. You arrange follow-up visits within 1 to 2 weeks. This is to ensure that there are no further complications and the patient is recovering. So what are the objectives of post-abortion care? The most important objective is to save lives. That's to avoid maternal mortality, prevent repeat unintended pregnancy, restore reproductive health, and empower the woman with information and choices. Here, you educate the woman on forms of contraceptions and other choices in order to prevent unintended pregnancy, because it's from unintended pregnancy mostly you get abortions, especially induced abortions. So, though abortions may be illegal, post abortion care saves lives and it is legal. Thanks for listening.